Have it in just another minute. So, well, Central Pines, y'all get you get the award for the most creative spot on the Zoom identification there if you're a pine cone. Okay, looks like folks are coming in pretty good. We're going to give it another 30 seconds and then we'll get started. Well, good morning, everybody. I'm Mary Bethel, Board Chair for the North Carolina Coalition on Aging. Thank you for being with us today. You never know about weather, what it's going to be, so hopefully, and how it's going to impact attendance. But today's weather is not bad, so hopefully we'll have a good crowd. I always kind of start meetings when I see that we've got at least 40 people on, so we have over 40 folks now, so we'll get started. But thank you for being with us. Hope you've got your milk and bread already. If not, after we get out of this meeting, y'all hightail it to the grocery store. So we've got I think, an exciting meeting today. In addition to our usual things that we cover, we've got presenters with us today from the National Alliance for Caregiving, as well as the ARP Public Policy Institute. So I think it will be a very engaging and informative presentations that we have from those folks. So good to see you. As I said, just a couple of things. I want to first recognize Catherine Hupp with North Carolina Division of Services for Deaf and Hard of Hearing, who's going to just give us a few pointers about our CART services and our ALS interpreter services. Catherine?
Hi, good morning, everyone. Just want to go over the process for setting up captions if you're interested in viewing that. We also have interpreters here today. So we're going to have American Sign Language and Communication Access, real-time translation, CART captioning. If you would like to access the CART captioning through your Zoom screen, they did change up some things on us. So on the bottom of your screen, there is a More button with 3 dots. If you click on that, you can select Show Captions on the screen that pops up, and that will allow captions to pop up on your screen. I will also share a link to view the captions in a separate window in just a minute. This link will allow you to change the font size and the color for visual accessibility. And you can also enter your email address to be emailed a transcript after the meeting. American Sign Language users can click on the 3 dots next to the interpreter's name and select Pin if you would like to view the interpreter larger. And once there is a presenter with a PowerPoint on the screen, you can select side-by-side gallery view at the top right of your screen where there is the view option, and pin the interpreter by clicking the dots next to their name. And this will allow you to drag and increase the size based on your preferences. And I will add in the link here. If anyone has any questions, feel free to send that in the chat, either directly or to me or just in general. And I'm going to send the link one more time. There you go. Okay, thank you very much.
Okay, thank you, Catherine. Appreciate it. As I said earlier, I know there's some more people on. If you would just add your name and organization, helps us with interpreter services as well as just knowing who's here for sure. Okay, the minutes from our last meeting, which was in early December, have been posted on our website. So if anybody has questions about that, in addition to the recording from the minutes meeting, as well as the slide decks and things from the presenters. So you can find that information on our website for any of our prior meetings. So this time, let's see, I'm trying to see if I see our treasurer.
No, Lee's
There a
not
little.
on,
Okay, he's not
able to be
on.
on this
So
morning.
Sandra, you want to just give us a brief update about our financials?
Absolutely. Happy New Year, everybody. Good to see so many folks on this morning. We did have a very a good year as far as at the end of the year we had a positive bottom line, so that's always good as a nonprofit. We had a couple of good things that happened with our board meeting, I mean, with our annual meeting that helped make that bottom line very positive. And so we're very well situated to move into 2026. The board just adopted the 2026 budget at our meeting earlier this week. So Mary's going to be talking about some more things that are coming out of that board meeting a little bit later on. But overall, our financial picture is well.
Okay, very good. Thank you. All righty. Sandra Phelps is Executive Director for the Coalition on Aging. Sandra, while you're talking, why don't you go ahead and go into updates?
I will do that. We kind of teased at our December meeting, and I want to welcome, I just saw her from North Carolina Health News is on. Is it Ashley? Is that right?
Ashley Spriggs, yes.
Yes, yes.
I'm
So,
here.
yes, thank you for being here this morning. I'm also letting people know that there's a reporter on, so they speak very freely, but maybe they don't want to say everything that's on their mind this morning, and I'm saying this to myself as well. Um, but we teased at the December meeting about the membership survey that we had sent out last fall. And I'm pleased to report that we had a pretty good turnout of survey respondents on that. And thank you to Teresa Troop and also to Kay Castillo, who helped kind of coordinate those responses for us. We presented it at our December board meeting. And as you can tell, we're still meeting on a Friday because that was the majority respondents said that the Friday time frame worked best for them. So our meetings for the remainder of this year will continue on the fourth Fridays of the month, except for, I think in May, we meet on the third Friday. And so that was good. We also asked about our annual meeting, which we have traditionally held the last Friday of September, or the fourth Friday of September, and should we move that? And I think we put October as a potential date. We put the first Friday of December as a potential date, and everybody again, the majority of the responses were keep it on the Friday in September. So that is what we're going to do for this year. So that was very good responses. We got some comments, some good comments from various folks as far as what they like about the coalition. And one of the first questions was, which do you prefer or what like the best as far as is it the newsletter? Is it the monthly meetings? Is it the networking? And by far the newsletter and the monthly meetings receive the highest marks for what people value in what they receive from the coalition membership. So again, we're very thankful for your participation in that. And please, as always, feel free to reach out if there's something else that you have a question about or something that you perhaps would like to see. And we'll be glad to take that into consideration as we're moving forward with our meetings. Interestingly, we also posed a question of would you like to have a annual meeting and advocacy day in the spring? And the majority of people, well, a good majority of people liked that option. However, there were a lot of concerns of the expense that it would incur for people to come for a basically 2-day event, having to spend overnight. So people really liked it, but with budgets the way they are right now, I think people just did not see that that was something that would be feasible for them. So for 2026, we're meeting on Fridays. We're having our annual meeting in September, and we're going to have some exciting times this year. So speaking of exciting times, I had the pleasure of attending a House Committee on property tax last week with Mary was there, and Chris Brandenburg from AARP, and maybe some other folks that are on this call. That's really the first time I had sat in on a committee meeting, and you see how our legislation works, and it's very interesting just from a consumer standpoint, from a taxpayer standpoint, of how what they do affects me. Because we were talking about property tax, and there was some presentations from individuals talking about how that works in North Carolina related to the counties, to the municipalities, how it's uniform as far as the tax code, the way that it has to be in all of the 100 of our counties. But just to kind of again educate yourself. Of course, the property tax issue is one of the priorities for the coalition. It was last year. It's going to be again this year. Mary has taken the largest part of attending those meetings and other meetings related to Medicaid and things that are happening on the state level. But that, and I say this in all seriousness, that the General Assembly is the people's house. We pay for that. We support that. And if you can only make it to a committee meeting once a year, it's worth going up there just to see how you can educate yourself, or how you or your organization can plug into what's happening there. It's not always fun. They're long. I think the first meeting Mary attended of the property tax went 3 hours in December. But again, it's an opportunity to make our voice heard. Anything else you want to add to that, Mary? You're going to speak to it in a minute.
Yeah, I'll speak to it in a minute. Go
Okay.
ahead.
Okay. Also, been attending some various meetings. I represent the coalition on the North Carolina Association on Aging board as well. So we had a meeting in a couple of weeks ago, last week actually. Who said that January was a slow month? I mean, we just hit it running first week of January in meetings and just continued on. So that board is a very good board to work with. Of course, they sponsored the state aging conference, which is not going to be held in 2026. They've kind of stepped back to do some planning. Right now, they're planning for the state aging conference in March of 2027. So look for more information from them on that. And I am also represent the coalition on the Older Americans Month committee, the statewide committee that is led by Misty Pykar, who is in the Division of Aging. She is actually an attorney and has lots of different titles and very important work that she does with the Division of Aging and DHHS, but she is leading this effort. We have our first committee meeting on Monday for the Older Americans Month, which is May. So we're going to be looking for different ideas of how we can celebrate Older Americans Month in North Carolina. And so I'll be sharing that with you as our members in the coming months. Also, and finally on my report, we have our membership renewals and invoices for 2026 are going to be going out soon. Our membership year for the coalition is actually January to December. As we have indicated in past meetings, because of the change in organizationally, we as the coalition have not been as consistent in notifying members of their renewal dates and and things. So we're going to make a more concerted effort to do that for 2026. I know I've already received some renewals in January, but our goal for this year, we'd like to have at least 100 individual members and 90 organizational members. Just to remind you, the individual membership is $25. Organizational membership is $200. So hopefully we'll be able to attain those goals coming up. If you have any questions about your membership, I know some folks are have recurring memberships. In other words, they've signed up and their credit card is charged annually. I can let you know if that is the case with your membership. But we appreciate all the memberships and appreciate everybody's attention and taking time out to hear about the coalition updates and also hear about what's going on in our caregiving world with our upcoming speakers. I think that's all I have right now, Mary.
Okay, well, great. Well, as Sandra said, I think there's a lot going on. Things get real crazy in December of everybody trying to do everything before the holidays. And then we have the holidays, and then you come back and try to do all the makeup things you didn't do for those 2 or 2.5 weeks there at the end of December. So there's is a lot going on. One of the things that's happened since our last meeting, the coalition, along with many of you on this call, we're very engaged in the issue about the Medicaid provider cuts that were instituted back last fall. Those cuts were done away with, and full rate reimbursement was reinstated in December. So we're very glad for that. But we still have the issue about the General Assembly is going to still need to address the issue of the shortfall with the Medicaid budget with the rebase. So that's something that hopefully that there will be some action on when they probably in April. It's looking like that the General Assembly is probably going to take any action on anything budget wise until April at this point. So that's something that we will certainly continue to follow. Sandra mentioned the House Select Committee on Property Tax Reduction and Reform that has been meeting. It's had 2 meetings so far. It's got another meeting that's going to be scheduled for February 18th, and there's another one's also on the books already for March. We certainly are following this issue very closely, and along with AARP, which has had a big presence on this matter too. But primarily from our concern will be the issue about trying to look at the existing property tax relief programs that are on the books in North Carolina for older adults. We have the homestead property tax exemption, and we have the circuit breaker provision. Both of them are a little bit different, but they do provide relief to low-income older persons and persons who are permanently and totally disabled. Those income level and exemption amounts have not been upped in a number of years. It's probably been at least 12 years since anything was done relative to them. And what we're seeing are kind of 2 situations. You're seeing that a lot of smaller counties, particularly property tax is the most stable source of revenue that counties have. And it is the largest source of revenue that counties have. And there is a lot of interest among counties in ensuring they've got that stable property tax base. And what's happened is a lot of the low wealth counties have had to increase their property tax rate in order to continue to address the ongoing cost for services and programs, things of that nature. So you've got that situation in a lot more rural counties with the rates going up some. But you've also got a big issue in a lot of our urban and metropolitan areas in North Carolina, particularly with the cost of housing going up. We're seeing that in a lot of communities, and Wake County is a very good example of this, where a lot of very established old neighborhoods where people lived in homes for 4 and 5 decades. If a home comes on the market, or if somebody, is approached by a developer or somebody that wants to buy their home, and the home changes hands, and it is bought by somebody who might come in and tear that home down and build a much larger house. What ends up happening is those people who live in those homes that have been there for years, many of them on fixed incomes, the property tax values really go sky high. And a lot of them are finding they're not able to age in place because they can't afford the property taxes. So we've had lots of counties, the metropolitan counties, that have wanted to do they want some change in the property tax laws in order to allow them to do things. However, because of the uniformity provision that exists in our state that says what's done with one county with property taxes has to be done in another county, in all other 99 counties, it's been hard to get anything on the books. So we are, following this issue real closely. We think there might be a possibility that we could talk to the General Assembly about, and we're scheduling meetings with their leadership to talk about this, the leadership of the Property Tax Committee, about whether or not if counties wanted to do something above and beyond what is allowed by state law, the uniformity provision, if they would be able to do that if they financed it out of local funds. So that's an option that we're going to explore with the General Assembly. Thanks to Chris Brandenburg with ARP for taking the lead and particularly working with the General Assembly on this. But the coalition and ARP are very much in step on what we're doing relative to this. So more to come on this matter, but just know it is a huge issue. The issue has kind of taken on not only the aspect of looking at property tax relief for people who need it, but also some people who question why we have property taxes and the whole issue of how property taxes are done in North Carolina. So it's a kind of a bigger issue than just property tax relief that is entering into the picture. So we'll see what happens relative to that. We had mentioned, I think, at the last couple of meetings that the Coalition on Aging was asked to coordinate an article for the North Carolina Medical Journal in December about Medicaid, home and community-based services. That article is out as well as the whole journal. It's a great article about Medicaid in North Carolina. I mean, great edition about Medicaid in North Carolina. I'd encourage you to check it out if you have time to do that. But it's online at the North Carolina Institute of Medicine website. But particularly want to thank Lee Dobson, who is the vice chair of the Coalition on Aging with Hearts for Home Care and Beata Home Care for being a lead author on this, along with Andy McCracken with the North Carolina Center on the Workforce for Health, as well as two staff members from the Duke's Home Care and Hospice program that we're very much engaged in this. So we're excited about the article and glad that it was published, and think it talks about the importance of home and community-based services in our state and the important role that Medicaid plays in funding this. We have finished up the Essential Jobs, Essential Care grant that we had from Z. Smith Reynolds. We had it for 3 years, I believe it was. And we did a lot of work, Patricia, with Trish Farnham on staff, to address workforce crisis among direct care workers in North Carolina. We're pleased to announce that the Center on Workforce for Health, who Trish now works for full-time, is taking on the lead responsibility for continuing this committee, and that we'll be working lockstep with Trish and with the center to continue to advocate for workforce issues for the direct care workforce. I don't know if you guys saw it up, but if you happen to take Our State magazine, the November edition of the magazine had a wonderful article about Meals on Wheels, particularly specifically the Meals on Wheels program in Cabarrus County. It did a great job of capturing the importance of Meals on Wheels to folks in North Carolina, the important role that volunteers play, that the agencies play, and that the whole process of how it's a team effort to get meals to thousands and thousands of people across our state. So I encourage you to check that out. It's online too if you want to look at it. The Charlotte Observer is doing a number of articles about caregiving. They had one that came out about 10 days ago talking about the challenges that caregivers sometimes face, the emotional tolls, the physical tolls, things of that nature, but how rewarding it also is. It's a great article. I encourage you to go online and look at that. The author of that is Brianna Lumpkins, and she also is getting ready to do another article about some non-traditional approaches to caregiving too. So I think it's good that she has that interest in doing that. Since we also met, the state of North Carolina has received $213 million for a rural health transformation grant. I know that many of you on this call had provided written comments about that grant. The Department of Health and Human Services actually did a teletown hall, a webinar on this last week that laid out a lot of what's being what's being looked at. I know one of the issues that has come up in discussions about the grant is that North Carolina DHHS used the most advantageous definition of rural that would allow them to draw down as much money as possible for the state for the grant. However, the definition that was used, which is utilized by lots of states, it's kind of quirky in how things sometimes fall out. For instance, like Wake County is listed as a rural county, but Pitt County, which is Greenville in that area, is not, which is very rural in northeastern North Carolina. So I think a lot remains to be seen, and they're trying to work out all the details about how they can address the rural needs of all North Carolina, when there's specific things that the grant is proposing to do. But I think what they've come up with is very is a very good plan. It looks at how you can enhance primary care, how you can address chronic care issues. I see Lee has just oh, that's about the Medicaid articles. Thank you, Lee, for doing that. But also, if you go online to Department of Health and Human Services website, they've got a lot of information about the Rural Transformation Grant there, and encourage you to be involved. They are going to be setting up what they call 6 root centers. These will be kind of the hubs across the state that will be coordinating efforts. So I encourage all of you to be engaged in finding out what's going on in your area and become part of that process, and ensure that older adults and their needs are certainly represented and addressed in this process. The General Assembly will be coming back in April for the legislative short session. At this point, we think it's probably going to be a very short session just because of the fact that it's an election year. We hope that they will, even prior to the short session starting, address this year's budget, but they may wait till next year and do a budget. So we don't know. I see Julia Adams and some other folks who work a lot at the General Assembly on the call. I don't know if you guys want to add any insights you guys have or any thoughts you have relative to the legislative process going forward at this point.
Hi, everyone. I got name checked, so I'm going to pop in.
sorry, just do that on the spot.
Absolutely no worries whatsoever. So, if we are looking out at the horizon on what we expect to see next, it is my understanding that there will not be any kind of budget movement in the month of February for any of our budget concerns, be it education, state employees, obviously Medicaid and healthcare. We do expect to see some more joint legislative oversight committee meetings, most likely not in February. My understanding it may be March and April. And we are expecting, based on everything we're hearing, to be prepared not for a full budget, but for a series of mini budgets. So for those of us who lived through the mini budget moments, mini budgets are targeted budgets, kind of like what we're seeing in the federal government, that only deal with maybe 1 or 2 subject items, and then they move that, and then they do another one, and they move that. And we will probably see a rolling mini budget process. It has a lot to do with the fact that there are still some very big issues on the table that the House and the Senate are still working through and have not come into alignment on. Those include the North Carolina tax incentive packages, the ones that keep dropping your corporate tax and your personal tax, as well as, the Children's Hospital, which is still on the table as well. So everything we are hearing at this point is to prepare for a rolling series of mini budgets. I do believe, Mary Bethel did a beautiful job of explaining this. I do believe there is a conscientious effort between House and Senate membership and leadership to fund Medicaid. And I think you can feel that when you're in the Medicaid Joint Legislative Oversight Committees. There is a real concern around House H.R. 1 and the impacts of H.R. 1 to our state's budget. And I think that they do want to go ahead and fund Medicaid. I do believe that is true. I also think that on some of HR1's elements around the work requirements for the expansion population, as well as the 6-month eligibility on the work on the expansion population, they are going to have to get very creative, both in the way they are doing that and the way they are funding it. I would not be a bit surprised if they asked CMS for some delays. Because right now we're just not ready to take on at least the work requirement portion. When it comes to definitions, also, I just want to say one of the big things we are all working about. Someone asked a really good question. I'm sorry. I'm going to stop right there. When you say fund Medicaid, do you mean the traditional Medicaid? That is correct. So when I'm talking about funding Medicaid, we're talking about the Medicaid rebase. The Medicaid rebase is what is funded in the North Carolina General Assembly budget. Medicaid expansion is funded 90% by the federal government and 10% by hospital share. And so whenever we talk about having to deal with a Medicaid rebase, or the issue that we had with the Medicaid rate reductions, or when we're talking about a comprehensive Medicaid budget, we're really talking about that traditional or legacy Medicaid program.
Sorry, I'm the one who asked that. Can you then just say what we're thinking about the expansion group? Any discussion about that?
Thank you so much. Yeah. So with the expansion, their Medicaid services are fully paid for outside of the general fund appropriation. 90% of the money that goes into Medicaid expansion is federally funded. 10% is from the hospital share. Now, the concerns that have always been historic with that conversation in the Medicaid expansion population would be, do any of the changes to the 90/10 disengage the Medicaid expansion population, which is what I think you may be, I can see you shaking your head right now. Right now, we do not see on the federal side any other changes in the minibus, which is their version of a mini budget that is moving right now, or in any legislation that I am aware of as of this morning to upend that 90/10. There were some concerns around it around HR1. It had been included at one point and then removed. Now, I say that, but I also want to reflect back that North Carolina has triggers in our state law around if we don't get that 90%, or if we, don't get work requirements approved. But we are working, because it is now the law of the nation that we have to have work requirements for populations. But there are a lot of carve-outs over there, and I think the next big conversation is how do we assure that anyone who is in that expansion population is not impacted by any of the changes. Mary, I think
there's also a second question.
Yeah,
there's a second question from Beth Smith. She says, and with the mini budgets, does that mean you think there won't be a full budget even in the short session or July timeframe?
That's correct. I do not think that we will see. I think the short session will be very short. I say that every year, and I'm proved wrong, Mary Bethel, every year. But I think this year I may be right. There's enough of us saying short is short this year. So I think we will see a series of mini budgets. I don't think that there are things they have to fund in an election year. I think they will prioritize those things. I think they will fund those things, but I do not think we can get at this time to a comprehensive full budget.
Of course, a lot might depend on primary elections and things like that too. So
yeah, I think it's a rude disagreement that we're having a problem getting around at this point. But yes.
And of course, there are a lot of problems that are caught kind of in this budget impasse. We've talked several times on this meeting about the fact that groups like North Carolina Senior Games which is a private nonprofit, most private nonprofits have non-recurring funding. So when you don't have a full-fledged budget passed and you're just dealing with mini budgets, you don't get funding for those that have non-recurring funding. During that process. So that's tough. So there are a lot of nonprofits that are caught in this dilemma. Not only North Carolina Senior Games, but lots of nonprofits that are.
So there are some other questions. I'll do my very best to answer in this. Do I think that there will be state employee raises? I do believe, based on people's conversations, that is something that really is critical to fund because of the fact that we are, in an election year, and that is very important. Do legislative days matter in a year with a short budget? So, North Carolina's Constitution does not have a start date or an end date on long sessions or short sessions. Technically, we are still in the long session that started January of last year. Welcome to 12-month sessions. So, no, and what we will most likely see is even if the short session comes in and comes out, we'll see a rotating, kind of what we've been seeing this year of what we call skeleton sessions, come in for 1 day, 2 days, 3 days during an adjournment resolution. Mary Bethel, I really wish we were just a year-long legislative body at this point and just let's bite the bullet on that one and move it on along.
Yeah. Well, thank you, Julia. Julia's with Oak City Government Relations. If she has her own company, so if anybody's wondering who she's with, thank you so much. Anybody else who routinely follows all that's going on in the General Assembly want to share anything about what you're hearing or anything else that is relevant to this conversation about budgets or what might be going on in the legislative process? And I hear crickets here. So I will say that we're as far as like what might be on a legislative agenda for the short session. I think what Jules just said, it probably is going to be a pretty short session. They can take up things that there are things they can take up. Technically, for bills that are non-budget items, they can take up things that pass one house or the other. You can also take up things dealing with budget and taxes and things of that nature. But the other thing they can take up are governor vetoes, and there are a number of vetoes that have not been overridden yet. So that may be something also that's going to be on the agenda. So it's kind of a continuation of where we've been for a number of months now. Just kind of wait and see what's going to happen. Julia mentioned about the work requirements. I think the official name that I think is in the bill and all is called community engagement for Medicaid and food stamps. Now, food stamps is already pretty much geared up. Work requirements for Medicaid is something that is new. And as Julia said, it's going to be really hard for North Carolina to meet the deadline that has been imposed by HR 1, the federal One Big Beautiful Bill legislation. There was a presentation last week at one of the joint legislative oversight committees about things that are going to need to be done legislative wise in order to put the work requirements in place. And, the statement was made by one of the leaders of the Health and Human Services Committee in the House was that poses a time frame problem because the General Assembly probably will not be back in session taking up things that the state is saying that needs to be addressed by the end of March. So I think that's one of the reasons, as Julia said, why North Carolina, and I'm sure other states also, will be asking for an extension of that deadline to impose Medicaid work requirements. So it's going to be interesting. I do want to say one thing about the food stamp work requirements, though. Back one of the first jobs I had out of college was working for a local Department of Social Services, where I was what they call an eligibility worker. I determined eligibility for food stamps, Medicaid, and at that time you had all these public assistance programs like old age assistance, aid to the blind and disabled, things of that nature. We don't have those anymore. We have SSI. But I did food stamps. And it is almost impossible not to have an error on food stamp eligibility calculations. Things change. You're dealing with human beings. Maybe you have a situation where somebody gets a 10 cent an hour raise in their income. But that would technically change how much food stamps they might get by a couple of dollars or something like that. So, there's lots of things that can result in error rate. And we know, I think North Carolina's error rate's a little bit over 14%, which is the level that has been set by the federal government to say you're going to lose lots and lots of federal dollars unless you get your Medicaid error rate down. We've got many counties in North Carolina that are below 6% error rate. Our eligibility, in North Carolina is determined by county departments of social services. We've got many counties that the error rate's less than 6, but we got a lot of counties that is more than 14 even. And, so much of that depends on the ability of the county to have workers to and have the time for these workers to do all this eligibility determination, as well as there's a lot of churn in those positions because they don't pay great amounts of salary, and it's a very demanding job. So bringing new people constantly on and off. But I think lots of times people, when they hear North Carolina's got an error rate of 14% on food stamps, is they think of, fraud and abuse, mismanagement, things of that nature. But it is a much more complicated issue than that. And I think the states that you will see that have the overall error rates that are very low are much smaller states. North Carolina is the ninth largest state in population in the country. And, we're going to have mistakes, unfortunately. But, I don't hope people don't come away with the idea that we've got mass mismanagement of our public benefits programs, or that people are abusing the system wholesale, wide, or anything like that. It is a very, very complicated issue. And I think that the state's going to be doing a lot of things that are going to try. Certainly, they want to get this error rate down because you don't want to lose all these administrative dollars that the federal government will take away if we don't. But things such as using more technology to compare wages with what's been reported, to look at tax returns, those types of things. So I think it's going to be one of these situations that the state is evolving. We're trying to look at the systems that can be out there to help make it work more efficiently, and trying to look at the cost of doing it. But a lot of the funding for these for workers at the local level that do this also come from county funds, as well as state funds and federal funds. And the funding is limited. And in these small counties that are struggling with budgets, it is a real hard challenge for them to keep positions full. So that's my kind of soapbox for today relative to that issue. But it is one that I think that we need to keep in perspective about realities of what happens at the local level and how it plays out when you look at how policies are perceived or carried out. So anyway, that's my that's my soapbox for the day. That. All right, so I want to turn attention a little bit to just some things regarding the coalition itself. So y'all know we reported on last year that we have a very concerted effort to look at, increasing funding for the coalition to carry out our work, and also to increase the footprint that we are able to have in North Carolina, and to be able to be effective in what we do, to the member support type things like the newsletter and monthly meetings, but also to the advocacy and policy work that we really do. Now, up to this point, I have been doing in a volunteer capacity a lot of the advocacy and policy work, taking the lead on it. I'm going to be stepping back. I'm not getting out totally, but I've got family issues. I'm not a young kid anymore. So I want to travel. I want to do lots of things, but I want the coalition to be positioned that we can do more than what we're doing in this area. So we applied for the Z. Smith Reynolds grant back the end of last year. We asked for a sizable amount of money in order to add 2 staff positions that would do a lot of not only helping with the day-to-day operation things that we do in order to make the coalition run effectively, but also to increase our footprint in advocacy and public policy work, particularly in the areas of housing and long-term care type things. We did not get all we asked for. We are getting, though, for 2 years, $50,000 a year for 2 years, so a total of $100,000. So our board has looked at all the budget items and income that we have coming in. We have sponsorships. We have for our annual meeting. We have our partnership relationships. We have some grants, and we have our membership dues and things of that nature. So all total, we think that we will be able to hire a second position for the coalition. Now, that came down to looking at what do we need to do as a coalition? What are the functions we need to do in order to be most efficient in our operation? We need to keep doing the things that we're doing now, which is the overall management, member support, maintain at least what we're doing now in advocacy and public policy work, and increase more of what we're doing in the area of education offerings and things of that nature. So Sandra and I've had a lot of discussions about this. Our boards had discussions about this, And basically what our board has voted to approve as far as the coalition moving forward is that we will hire a second position. That position is going to be focused more on advocacy and policy and the overall oversight of the coalition. So that will be the executive director position. Sandra has been just a godsend to the coalition and what she's done to just keep us organized and functioning and just, doing day-to-day type things, as well as representing us very well in the arenas we need to be represented in. But she can't do it all. She also lives in Newburgh, and we feel that she does those things so well, and she also is not she's not passionate about doing all the legislative type stuff, which she knows that we need to if we're going to move forward. And quite frankly, the environment we're in right now, if we don't enhance our footprint in the area of policy and advocacy, we're going to be left behind. So Sandra is going to assume a operational director position within the coalition, and we'll keep things pretty much the way they are with a lot of what she's doing. But we're going to be hiring a new executive director. Now our goal is to do this effective. We would like to have somebody on board April 1st, but we're in no rush to do it because things are humming along good right now. And I'm willing to, continue doing what I'm doing for a while here too. So there's no urgency to that, to moving forward on this. We will be posting, however, starting next week, the job description for executive director. It will be open at least through the month of February, and we will, feel free to contact us for questions or whatever. You will have salary information, job requirements, qualifications, all those types of things on that. But look it over. If you know people who are interested, we will be pulling together a committee again that will be in the process of making, screening candidates, doing interviews, making recommendations for the board to consider, that type of thing. So that's where we stand as a coalition. We're excited about this next step. We think that if we don't take this next step, we're going to be, we cannot move forward. And it's one of the things that we are having to take a little bit of money out of reserves in order to fully fund the executive director position, but we think we can do it. It's also going to free up, with two people, we will be able to focus more on fundraising and being able to expand our revenue base in order to continue to do things that we need to do. So I can take a couple of questions, but I know we've got a program starting at 11. We need, and some other things on the agenda. I don't know if anybody has questions, but I just encourage you to go online, look at the information, and we'll post the job description on, and we'll put it on the coalition's website. Sandra, maybe put it under the news section on the coalition's website. But here again, I cannot say enough about what Sandra has meant to this organization, what she has done for us, and the fact that, she just has kept us together. And we do need, though, we think, to have somebody in this executive director position that's more based kind of in Raleigh or the Raleigh area and can take on more policy and advocacy things. So any questions or anybody have for anything? Okay, I don't see any. Sandra, you see any hands?
No, I don't.
Yeah. And Sandra's fine with this. Sandra,
Yes.
Anything you want to say?
I'm just, one of the things that when I first took this job, we did talk about the policy part of it and advocacy and possibly registering me as a lobbyist. And then after a couple of months, Mary said, "Why are we going to register you as a lobbyist? You don't know anything yet."
I didn't say it that way.
Teresa, I'll let you judge whether you think she said it that way or not. But no, it's something to that effect, which was the truth. I did not know, about the aging landscape. But also, as everyone who's been in this field for a while, and Mary said, the landscape has really changed. And so even she is saying, things are different than they really have ever been, particularly with the sequence of events that happened in 2025. But also, there's lots of different reasons behind me that the policy is not something that I am super passionate about. Had the board said, yes, we definitely need you to do this, then that's different. But we're looking at ways to extend what the coalition does beyond just the newsletter and the things that I have become very comfortable with. And also, as focusing on the membership and how we can work with you. So for those of you who thought you weren't going to see me much anymore, then, yeah, you're going to see more of me. But hopefully that will also allow us to do a lot more things, really gearing the communications, looking at ways to make our website more accessible, a resource for folks to go to, things of that nature. And I'm going to still stay involved with the different committees that I'm on. So there's plenty of work to be done. But I'm kind of excited about this change. Yeah, I kind of do miss the thought that I'm not going to sit in 3-hour committee meetings at the General Assembly. I do hear they have a good cafeteria in the basement, but I'm very happy with this. So I'll leave it
there
at
was
that.
a little irony in that comment there. Okay, thank you, Sandra. All right, I am conscious of time, so I want to call on Daryl Davis Fulmer to talk about the Health Equity Committee and some things they have going on. So Daryl, I'm going to turn it over to you right now then.
Okay. Thank you so much, Mary and Sandra. Thank you for what you've been doing as a board member. It's just really noble and gracious of you, and passionate of you as well, to think about how to make this organization go in the direction of where it needs to go and how to get there. Not everybody would do that, so just know that we are thankful. So, the Health Equity Committee is working on some new direction. And actually, Mary, we're going to report on that next month
Okay.
so that we can have a full report on what we're doing and where we're going. And I think it's very exciting. And I think you all will like it. But as usual, I'd like to say if you're interested in working with the Health Equity Committee, please reach out to me or reach out to Rosalie, and we'll be happy to have you join us. But we'll have a full report next month.
All right, sounds great.
All right, thank you.
Appreciate it. And thank you and Rosalie for your leadership and for the people who've been leading up the work groups for the committee.
Yes, absolutely.
So I think we kind of covered state legislation. Just one thing on federal legislation. It looks like there's been some agreement, at least coming together relative to the budget that deals with health and human services at the federal level. There's still got to be some votes taken, but there has been at least some agreement on some key issues that had kind of been little snag points, I think, at some point. So hopefully there will be, we'll have a federal budget soon. And I know that some of you that are receiving federal funds, your funding is still, you don't know if you have grants or not. Last week, some of the mental health funds got pulled and then were reinstated the next day. So, it's kind of an adventure about what's going on, and just kind of have to buckle up and take it a day at a time. But I think there are things that are going on. So we've got a few minutes here. So I would like first just go ahead and go into the sharing aspect of our of meeting. I just want to say one thing. I see Jeff Horton on here. Jeff is the executive director of North Carolina Senior Living Association. Jeff is going to retire at the end of the month. So Jeff, thank you for your support of the coalition and for all you've done in North Carolina. Jeff worked for many, many years for the state. It used to be Division of Facility Services, then became Division of Health Services Regulation. And then has it been 10 years that you've been executive director of the Senior Living Association or thereabouts?
Yeah, almost 9 years. Yeah.
Almost 9 years. Yeah. So we're excited. You want to share who's replacing you? What's going to happen?
Yeah. Well, thank you, Mary. It's been a pleasure working with all of you over the years. Somebody just put a note. It's my second retirement. I guess it is, but time for me to do different things in my life. This next chapter. But at any rate, my replacement is going to be Stacy Massey. She's been our director of education for the past 2 years. She could be on the call today. She's traveling, but she'll be a great executive director. She has more experience in long-term care than I do. She was her background is she's a social worker, and she worked at in skilled nursing facilities for a number of years. Then she worked in for an adult care home provider company for over 20 years, and she's actually still working for an adult care home. She's going to be doing that somewhat, but with a primary focus on our managing NCSLA. So Stacy will be up and running in February the 1st. And yeah, I'm looking forward to it. And so my next chapter, and she's looking forward to her next chapter. So thank you so much, Mary.
Well, thank you, Jeff, and thanks for all you meant for aging in North Carolina.
Thank you.
And
Thank
I
you.
saw Bill Lamb put a comment in chat that you're trying to catch up with me with retirements. I've had 3, so you've only had 2.
Yeah. Yeah.
But thanks a lot. Also,
Thank you.
just wanted to, y'all probably have seen the announcement that Lisa Levine has been made the permanent executive director of Dementia Alliance, North Carolina. She had been in the interim role. She's been a long-term employee with that organization, so congratulations to her. And also, Karen Powell is a new executive director of the North Carolina Association of County Directors of Social Services. So, seeing a lot of change here. But do others of you have announcements or things, upcoming events or things that you want to make sure everybody knows about to put on the calendar? Anybody got any conferences or anything?
I would say if you do have any conferences or things coming up, I know we try to pull it together for the calendar. Just put it in the chat, and I'll be able to grab that information for the upcoming calendar.
If I may, I'll jump in. I'm new to the meetings. Vicki Gold. I am located in Lenore. I'm a retired physical therapist. I put in the chat that I wrote a book called Aging Safely, Wisely, and Well, a movement and mindset guide for older adults. And I am here because I would love to make the information in there available to any of you, your clients. Uh, uh, it's got a lot of information and some contributing authors, all related to both physical and mental well-being. So my information is there, and I'm just here to offer whatever I can. Thanks.
Vicki, put your contact information in the chat in case people want to get up with you.
Yeah, it's there. It's Vicki at it's a long one, and it's got the title of the book also. I put it in early on.
Okay, very good. Thank you.
So very easily, you just go to thera-fitness.com. So like therapist, and then a hyphen, and then the word fitness, and you'll find me there.
Okay, great. Thank you so much.
Thank you.
Let's see. Teresa, you had a comment. Why don't you share that?
So the North Carolina Division of Aging has taken the lead on a conference that is going to be held March 24th and 25th at the Hawthorne Inn in Winston-Salem. Winston-Salem. Registration just opened for that. We are encouraging anyone and everyone who touches Adult Day, whether providers, monitors, specialists, regulators, funders, anybody who wants to interact with folks from the state, counties, locally, to please reach out. They can reach out to you can look at the North Carolina Adult Day Services website, ncadsa.com. Division of Aging is actually accepting the payments and dealing with the registration there, but we'd be happy, and I know Rebecca's on this call, and I'm sure she'd be glad to take any follow up with any questions you have on that as well. It's the first time in many years that we've been able to do this, so we're looking forward to the partnership.
Wonderful, great. I see Linda Kendall Fields.
Hi, good afternoon, everyone. I'm Linda Kendall Fields, the director of the CARES program at UNC Chapel Hill School of Social Work, and I just wanted to announce a couple of things. One is on March 5th, our dean, Dean Ramona Denby Brinson, has decided to focus on aging, and we have a great program called Retelling Our Story of Aging, Reimagining the Future through Community Research and Action. And I'm going to place that registration into the chat right now. There
I
you go.
believe Allie already has.
Okay. Oh, Allie, you're so quick. Thanks. The second thing I wanted to say, just sort of alert you to, is that the dean has also allowed for the recruitment of 2 tenure track aging focused faculty members at the School of Social Work. I get to be on the search committee, keeping an eye on home and community-based services, as well as Cheryl Zimmerman's great work in assisted living and long-term care services. So this person will be focused on research, teaching, and community engagement. And actually, it will be 2 positions, either 2 senior faculty members or 1 senior and 1 junior faculty member. I think this is a tremendous step to bring that focus within the school. So I wanted to let you know that. Well,
Very good. Thank you. Beth Messer-Smith?
Yes, hi everyone. I'm Beth Messer-Smith. I'm the co-convener of the NC Families Care Coalition, which works on paid leave and paid sick days. And I'm also the state director for Moms Rising, so appreciate you having me here. I just wanted to lift up that we are looking at exploring opportunities to expand the state's paid parental leave program for state employees to also include a family caregiving component. There's finally some precedent for that in the South. Tennessee this past year passed through the legislature a 1-week expansion of state employee leave for end-of-life care. Governor Cooper had provided bereavement leave through executive order before he left during Helene. And it appears likely that this legislative session, Virginia, will pass a paid family and medical leave insurance program that would be not only parental leave, but inclusive of family caregiving leave as well as medical leave. And so we're looking to have conversations about what you all would like to see in that. If we were able to expand it, what would be a length of time? What would you be interested in as we talk to the Stein administration and others? So I'll put my email in the chat. I'll be reaching out to some folks to have some of those conversations, but would really love your input on what we need for family caregiving leave. I know that this is included in the Ages and Stages plan and would love to work with you all on that.
Right. Thank you so much, Beth, and thank you for all you've done to really keep this on the radar over these years. Okay, I see Heather Altman. I know you're on the road, but can you unmute yourself to say what you had?
Oh, can you hear me okay?
We can. We're good.
Put in chat line, I'm putting together the speaker schedule for my adorable Aging Well Together radio show. It says my internet's unstable. So if anyone would like to be a guest and can get to Carborough on Thursdays from 2 to 3, would love to highlight you. And some of you have been on the show. It's fun and would love to have you on the air. Okay, and it's radio, not TV. So chill.
All right. Thank you. Lisa, I see something about Lifetime Arts. You want to mention that?
Yes. I'm the Director of External Affairs for Lifetime Arts. And we have been working for the last year on a policy brief that really dives into the role that arts participation has in healthy aging. We've been working with a group of really amazing policy advisors from the SCAN Foundation and University of Florida School of Arts and Medicine, and we're really excited about it. It's coming out on February 10th. And if you'd like a copy, I put my email in the chat. We're also going to be doing a couple public programs that are talking about how you can use this. So I think this is especially beneficial for any folks who want to run some arts programming for older adults in their communities, but really have a need to articulate how that's benefiting more than just being a hobby. How is it actually leading to some of the healthy aging goals that are really major priorities? So please feel free to reach out to me if you have any questions about that or would like a copy.
Lisa, if you wouldn't mind, send Sandra a copy of that.
Of course.
And we can do something. We can plug this in our newsletter. So
amazing.
Thank you.
Yes, thank you.
Yeah. Okay, let's see. Tara Muller, something disability rights. She may have had to step off. I'm not sure. But anyway, she wants to make sure people know that Disability Rights' annual conference is May 6th at the Friday Center in Chapel Hill. Registration will open soon. It starts at 8:30.
Hey,
And
Mary, this is Tara. I'm sorry I couldn't
okay,
find my unmute button and I'm not camera ready, but yes, just wanted that to be on your radar, please. We have not yet opened registration, but it is always we always have a lot of interesting seminars and breakout sessions that I think you all will be interested in for older adults and people with other disabilities. And we do offer scholarships for people with disabilities or older adults and their caregivers, and it is always fully accessible. So, yep, May 6th, just please put it on your calendar and I'll have more information later when the registration opens. Thank you.
okay, great. Abigail with Division of Services for Deaf and Hard of Hearing. There you go.
Hi, yeah, I was just mentioning that we have a monthly calendar of events that gets sent out. So if anybody would like to receive that, you can email me. My email's in the chat. And then Sandra, where did you say that we could find your list of events? Because I would love to add that to ours. Like if they cross over, that would be great.
Well,
we just
yeah, we do the calendar. Like I've used your calendar before on our list of events. We're just looking at different events that our members do, and then we'll put like our annual meeting and our monthly meetings and things on there as well. So
okay,
great. Abigail, if you will put in your chat your email address, Sandra can add you to our email distribution list.
That would be great. Thank you.
Okay. Daryl Davis-Fulmer, you have something to?
Yes, I just put in the chat that we're offering a webinar on Medicare scams and elder fraud on Wednesday. Hopefully, if the weather doesn't take down all of our internet access, it's part of our Lunch and Learn series. It's free of charge right now. And so you could just register. I put the registration link from the website there. Our presenters are David Kirkman. Some of you may remember him as being the special deputy assistant for, I forgot what administration from the governor's office, attorney general. And he's written a book on elder fraud wars. And then there's Stephanie Bias. Many of you know her. She works with Medicare. She does Medicare Patrol. And she and he will be presenting together. So it should be very interesting. The scams and frauds have become much more sophisticated. So what you knew last year is not what's happening this year. They've strengthened their ability to really convince folks to join their mischievous efforts. So join this, and you can set up a watch party if you want to at your agency. We love to have you join us. So we have about 500, more than 500 people registered already. So please join us on Wednesday, January 28th.
That's right. Very good. Thank you. And Stephanie is
You're
with
welcome.
the SHIP program. I think most people know her. Yeah,
Oh,
almost.
yeah.
Somebody tried to get me the other day, and it was very convincing. If I hadn't been as savvy as I am,
Yes.
I would have fallen for it. So anyway, but thank
Absolutely.
you.
Absolutely.
All right, that's all the announcements I see anybody's got. Anybody else have one? If so, raise your hand real quick. Okie doke. All right. Well, let's move on. And for those of you in the second part of the program here, we just did the last 15 minutes on the agenda, so we can just, don't worry, you've got plenty of time to do your presentation. So as I mentioned at the onset, we're extremely pleased today to have staff from the National Alliance of Caregiving, as well as the AARP Public Policy Institute to be with us today. And we're kind of doing two things. We're talking about the new report that came out in 2015 on basic caregiving data, statistics, things like that. A look at family caregivers in the United States. And then they came out in October also with more specific information about states, including North Carolina. And then this whole issue of the community engagement of the work requirements for family caregivers is certainly getting lots of attention right now. So I know that not only has the Public Policy Institute, or PPI, at ARP done things on this. I know you guys at the National Alliance for Caregiving also are very engaged in this, as well as other organizations. But we wanted specifically for the folks with the Public Policy Institute to talk about the issue brief that they are, I think they call it Spotlight brief now. They just did call, entitled How States Can Support Family Caregivers Under Medicare, Medicaid Community Engagement Requirements. And Elaine, I think you probably have some things to add to this also. But anyway, first I want to turn it over to Kim Cantor. Kim is the Chief External Affairs Officer, and she's going to talk about the Caregiving in the United States 2025 report. So thank you so much for being here, Kim.
All right, thank you for having me. Do you want me to share slides, or either way works for me? Oh, perfect.
And Sandra's doing them, so she's good.
Awesome. Well, thank you guys. I appreciate the invitation. And while my name is Kim Cantor, I'm the Chief External Affairs Officer here with the National Alliance for Caregiving. I too am a North Carolinian and starting to freak out about all of the ice that is coming our way. I live in Charlotte, so I wish us all luck as we lose power this weekend.
Sandra, that's the wrong slides. Yeah, it should be the other set.
I just realized that.
Well, I can start to dive in just in the interest of time, and then Sandra, when you get them up, we're good to go from there.
There we go.
Okay. So yeah, thank you. I appreciate it. So I am going to share with you all information, some data from caregiving in the U.S. And sort of one step back. Next slide, please. Just wanted to give you all a little high level about the National Alliance for Caregiving. Some of you may be familiar, some others not, but we are an organization that really is seeking to be catalyst change or change makers through policy, system, and culture change. We do our work really through research and data and advocacy, and really pairing that with the lived experience of family caregivers. We have 3 strategic impact pillars that we work towards around championing caregiver health and wellness, driving economic inclusion for family caregivers, and then fostering caregiver-friendly communities. So really all of our work is under these 3 big umbrellas.
Sorry.
So, you're fine. So before I dive into caregiving in the U.S., we of course have to give a big shout out to our sponsors. If you go to the next slide. And again, you can go to the next slide from there. Without their support, this wouldn't be possible. This is an amazing project that we do. So Caregiving in the U.S. is a joint collaboration with the National Alliance for Caregiving and AARP. It is a report this deep dive report around the day-to-day challenges confronting family caregivers across the U.S. We released the new national report at the end of July last year, so just a few months ago. It is the 6th edition. The first one was done in 1998, I believe, and we're super excited where we've seen the project go from in the last 28 years or so. Next slide. So I think what's important, some of you may be familiar with the 2020 report. So we wanted to really just note 4 big changes or differences that you'll see between the 2020 report and the 2025 report. So in 2025, we were able to capture a significantly larger amount of data and respondents to the surveys. And so with that, we were able to add in state data profiles, which we'll get to in a bit. And I'll share some more specific information about North Carolina. In addition, in 2025, we did include information about family caregivers who were participating in caregiver payment programs, such as those offered through Medicaid and those offered through the VA. Another aspect that's new in 2025 is the CDC Healthy Day measures, and really taking a deeper look at caregiver physical and emotional health. And then also this expanded level of care index, and you'll see in the national as well as the state data, really this increasing complexity and intensity of care for family caregivers, which is pointing out big differences if you're familiar with the 2020 data to what you see in 2020. Next slide. So another thing before diving in is just sort of level setting on what is caregiving in the U.S., sort of who's involved. It is for those survey respondents 18 and above, those who are providing ongoing complex care, and it does sort of span the care continuum. So we're looking at caregivers of those who are providing care for those with disabilities, whether they be adults or children, those supporting those with serious illnesses, caregivers supporting older adults, and sandwich caregivers, sort of that large continuum of care. Next slide. And then at a really high level, what we're measuring, what you're going to see in the data when you have an opportunity to dig into the larger reports. You're going to see demographics of family caregivers, prevalence of caregiving, looking more at the financial situation of family caregivers, use of technology, again, caregiver health and well-being. So it's a big, I always liken it to the census, if you will, for family caregivers. So there's a ton of data and information in here. Next slide. So I'm going to start high level with the national data, trends and insights. As I mentioned, this report came out at the end of July 2025, and then I'll shift and talk more about the state data and North Carolina in particular. And that data and information came out at the end of October, so it's a little newer. Next slide. So one of the biggest insights we see here is there's dramatic growth since 2015 in family caregivers. So we went a 45% increase from 43 million to 63 million in 2025. So that's 1 in 4 individuals are family caregivers. That's a huge amount of people. Next slide. And another key insight that we saw from the national report is positive support systems are expanding, right? That's great, but the demands on family caregivers are growing faster than the services and supports can keep up with. And that's probably not shocking to anyone on this phone, but it's So diving into some of the different specific metrics, and I'll try and I'm not going to highlight everything here. I'll go a little bit quickly because there's a lot, but you all can, one, access the report, and two, have these slides afterwards to dig in a little bit more. So demographics, who's caregiving? Again, this is national level. The average age is 51. 29% are a part of the sandwich generation, so they're caring for both children and adults. The sort of gender is similar to what it was in 2020. Overall, 61% women, 38% men. I find it interesting that as you start digging into the data, the younger the caregivers are, that dynamic switches where you tend to see more, not necessarily more men, but a larger percentage are men than a larger percentage of men and less of women as the caregivers are younger. We see that 1 in 5 have a disability. And really, when you look at race and ethnicity background breakdown, very similar to 2020, 60% white, 13% African American Black, 16% Hispanic Latino, and then Asian Pacific Islander, 6%. Next slide. So what are caregivers doing? And top line is we know from this sort of data section that caregiver intensity is increasing. So 45% of family caregivers report that they're in a high intensity caregiving situation. And the report will define what that shares what that is, but it basically is that you are providing care for multiple people or an individual that has more than one condition. When we talk about sort of also started managing for multiple individuals as well. And then I think one of the things I find most interesting here, and I think is relevant to the next conversation around work requirements, is that more than half or 55% of individuals are performing complex medical and nursing tasks, yet only 22% receive training for these complex tasks. And it's interesting, there's an additional question that if you are receiving training for these tasks, what does that do for you? And 92% said they felt comfortable. So it shows that training is huge, right? It goes a long way to helping family caregivers feel more comfortable and confident in the work in what they're doing to help those that they are providing care for. Next slide. So diving in a bit here to caregiver health and well-being, again, top line, emotional stress is widespread among family caregivers. 64% report that they face moderate to high emotional stress. 1 in 5 report having fair or poor of their own health is fair or poor. And also that 1 in 4 report feeling alone. So again, it's sort of this just overall sort of stress, the physical, the emotional strain of family caregiving has seen increases since 2020. Next slide. The financial impact of family caregiving. Again, top line, financial impacts are extensive for family caregivers. And just pointing out some data here, I think a really important one is this around working caregivers. Oh, sorry, I went to the wrong side. Sorry, that 1 in 3 have stopped saving due to their caregiving costs, that 1 in 4 are going into debt, whether it be credit card debt, leaving unpaid bills, paying bills late. And then also, I heard you all talking about your equity committee. You know, this is a really important, I think, space in which to explore too, that Black and Latino American family caregivers are really experiencing the brunt of the financial impacts of their family caregiving journey. Next slide. So I got ahead of myself, working while caregiving. So also top line, 3 in 5 family caregivers balance both work and their care responsibilities. And I think the important thing to point out here is that working caregivers face greater financial strain than non-working caregivers. And to me, that's a really interesting nugget when you start talking about community engagement requirements, work requirements, just some data to continue to dig into around what is the experience of someone who's working while they're caregiving as well. Next slide. And then, you know, we never want to paint everything as just these negative, awful world, but there is purpose in care, right? That we do find that 51% of family caregivers find a sense of purpose and meaning from providing care. And also from a sort of a resiliency and support side, that technology has been actually very helpful to family caregivers and its growth since 2020 to 2025. And then also that really the long-term planning, if you're able to do that, that we're seeing a lot more of those conversations happening in advance, that people are really able to start to think through a little bit more what does it mean to be planning for providing care. Next slide. And then another piece here is just sort of unpacking like what caregivers want within all this data. And these are 4 really important notes to point out. One is that 2/3 of family caregivers supported wanting to have payment programs, like I mentioned in Medicaid and through the VA. And that was very significant with lower income family caregivers. On the flip side, 2/3 also found it valuable to have income tax credits, and that was really earners over 50,000 were very much in favor of the tax credits, but both are important. And there is a demand for both of those types of programming. Respite services. This was the single most requested support, and that 1 in 3 really want them. And I think, you know, as we'll see in some of the North Carolina data, it's one of the most requested and least accessible, or people don't know how to access it, or there's stigma associated with it, right? There's a lot of aspects, but respite care is the single most requested service. And then also we talk about caregiver health and wellness. Someone paying attention to the caregiver, that they want healthcare providers to provide them with a needs assessment. How are you doing? How can we help you when they're there with their care partner at a medical appointment? Next slide. So you all have your phones out. We also at the National Alliance for Caregiving created what's called the Caregiving in the U.S. Data Hub. And if you take the QR code there, it'll take you to our Caregiving in the U.S. Data Hub. And on that space, you'll be able to actually interact with the data. We've taken what is a PDF report and made charts and graphs that you can sort and do all sorts of fun stuff too. on the website. But in addition, you can of course download the PDF report. We have executive summary, various fact sheets. This is just listing a few here that'll grow over the next 4 years as we're really digging into this data. So it's a great place to go as a one-stop shop for anything you ever wanted around caregiving in the US. And again, it'll evolve as the years go on. Next slide. So now I'm trying to go quickly to make sure we have enough time, but about the state data and trends and insights within the state data. So next slide. Again, in collaboration with our friends at AARP, we released Caring Across States, a state data report at the end of October. And this is really taking all 50 states plus DC, so 51 state data profiles and putting it into one document with an addition on top of it, really an executive summary and analysis of what you're seeing across the states. The QR code here will take you directly to that state report. So really the top line with the state data report Caring Across States is that place fundamentally shapes your caregiving experience. Again, I think nothing shocking to this group, but really when you see it across the states and you see sort of the disparities that exists, that the prevalence and the intensity varies across states, that the recognition of family caregivers by health systems and by providers are vastly different experiences in states as well. And then that state policy really does shape what support is there for family caregivers. And this is just pulling out a point around that paid family caregiving programming and what it does, for example, in Iowa versus New Jersey. So I'm going to get to the good stuff that you guys want. Next slide. Let's talk about North Carolina. So North Carolina is one of the states that did have a deep dive profile on it. And just wanted to share here, high level, that there are nearly 2.3 million family caregivers, or 27% of adults in North Carolina are family caregivers. That's, I understand from our friends as a part of our Caregiver Nation state network from Karen, that this is a big increase. Right? This is what than data and information that's been reported in the past. Next slide. So I wanted to share here, this is a snapshot of just like what the front of the North Carolina report looks like. And if you click on this QR code, it'll take you to the state data profiles page, and you can find the North Carolina one. It's about 7-8 pages long. It is chocked full of information and data that we would love for you guys to use, dig into, put it in your grant proposals, put it in your advocacy materials, share it far and wide, because it is such a rich resource. Next slide. So I'm going to give really high level just some what we're seeing in North Carolina, and it's all again in the North Carolina report. But so who are North Carolina's? And I also share that the state data profiles mirror what you'll see in the national report. In some states, it won't be as deep, and in others, it'll be deeper, right? It just depends on who what the sample size was in each state. So they'll look a little bit different, but generally they mirror the national report. So who are North Carolina's family caregivers? We see average age is 49. That 3 in 10 live in a household with an income of under $50,000. And I think, interestingly, that 38% live in rural communities. Next slide. Excuse me. What are North Carolina caregivers doing? So this speaks to that intensity of care. What sort of activities of daily living are they doing to support their care partners? And when I talked about medical and nursing tests, we see that 56% of those family caregivers in North Carolina are providing medical and nursing tests. That's huge. And that 27% are spending at least 40 hours a week providing care. So these are some like really good nuggets as you're thinking through like what is the value of family caregivers in North Carolina, and what do they bring to help really uphold and buttress this system that we have. Next slide. So caregiver health and wellness in North Carolina, I think, again, sort of somewhat consistent with what you saw at the national level, but actually 1 in 6 experience 7+ days a month and poor physical health. And then when you add on that 29% are reporting, or sorry, that 9% are reporting like very much physical stress and strain. Like those are some interesting data points to really sort of figure out how do they all fit together. This is where we love stories, right? Like how to bring this data to life. Next slide. The hardship of caregiving in North Carolina. So 38% have been providing care for 3 years or more. This speaks to the respite care as the second bullet here, that 33% would find respite helpful, but 91% have never used such services. That's a huge number. I mean, it tells me that there's a demand for it. And so how do we get it in the hands of people who really are needing it and wanting to access it? And then another piece too here, which I think is interesting, is on the graph, which is around help, receiving help. And so it's fairly even, but 38% have no help at all, right? That's a little bit of a terrifying number, but also really important to feed into the caregiver health and wellness sort of narrative as well. Next slide. Oh, and so again, you'll find more information there. And I know we're going to talk about our colleagues at AARP are going to really dive into this, but I did want to mention, and my colleague Elaine can chime in at the end, that as a part of our Caregiver Nation Coalition, we did create a toolkit, an advocacy toolkit to support how the state of North Carolina and all states could really start to dive into having an impact around community engagement work requirements in North Carolina or at any state. So we have a template letter, some messaging resources and data resources that do tap back to a lot of this data and information in caregiving in the US. So I just wanted you all to have this, but I will not I will not take anything away from the great, amazing, detailed work that my AARP colleagues are going to share. So thank you. I appreciate it. And if you have any questions, feel free to email.
Yeah.
Sorry, go ahead.
Yeah, let's hold questions until we do both presentations. And it is such a tremendous report. Thank everybody that had anything to do with it. I mean, I think the data in there is going to be things that all of us will use and in many presentations and in our help guide our policy and advocacy work, and just great stuff. So thank you so much. So we do want to change gears just a minute, and I want to introduce our two presenters from the AARP Public Policy Institute. They actually are the co-authors of this spotlight brief that they're going to be talking about. Is Edom Hado. She is Senior Policy and Research Manager for the AARP Public Policy Institute, or PPI as we call it, and Brendan Flynn, who's Director of Long-Term Services and Support with the Institute. And we also have, Kim mentioned it, Elaine Diapaz. She is Vice President for Government Affairs and Policy with the National Alliance for Caregivers, who also has done a lot of work on this work requirements or community engagement aspect of things. So we'll turn it over first to Edom and Brendan, and look forward to hearing from you guys. Thank you so much for being here.
Thank you. Thank you, Mary, for the warm introduction. And hello, everyone. As Mary mentioned, I am Edom Hado, and I'm a Senior Policy and Research Manager at AARP's Public Policy Institute. And I focus on caregiving and long-term care issues. And my colleague, Brendan, who's the Director of LTSS, will jump in later on. But thanks again for having us to really talk about this important topic. I'll start by saying that this is personal for me. You know, I was a caregiver to my mother when she was battling cancer, and I really saw firsthand how having health insurance, health coverage, whether it's private or public, how it really helps the caregiver to really take care of themselves while they're caring for someone that they care for, or a neighbor or a friend. And so keeping that in mind, I wanted to say that I'm kicking off the presentation by really setting the frame, right? So thinking about why does this topic matter, right, for aging in North Carolina, how many caregivers rely on Medicaid and the importance of coverage for this group in particular, and what the One Big Beautiful Bill Act, which we refer to as OBA, changes in Medicaid policy, and then briefly touch on two state choices that shape stability for caregivers. And then my colleague Brendan will walk through some of the operational implementation levers in detail that states can provide to protect Medicaid coverage for family caregivers. And so on this slide, at AARP, our caregiving page is a central place to send people to for clear information, updates such as our latest reports, this one that we publish, and practical too. So it's really something for you all to check out, explore, and so forth. Next slide. And so, as many of you on this call are already aware, North Carolina's family caregivers are really the backbone of the state's long-term care system. And Medicaid coverage really supports their ability to keep providing care. And now we have new federal Medicaid policy changes that create a risk or challenge around coverage disruptions if exemptions aren't really implemented smoothly at the state level. And so we'll go into more detail ahead. But what I want to say here is that while caregivers are legally exempted for the most part in OBA, our focus here is on the implementation, right? And so not just how states follow the law, which is essential, it's more so how they design the process to avoid any procedural coverage losses for family caregivers. Next slide. So our analysis finds that about 7.3 million family caregivers ages 18 to 64 rely on Medicaid for their own health coverage. Many of them provide 20 or more hours per week of care, and most provide care alone and support and also report financial and or emotional strain in their role as family caregivers. Next slide. So what's the typical profile of these caregivers? Caregivers with Medicaid coverage are often supporting someone with a disability, and they provide a mix of daily support. So thinking about activities of daily living, such as bathing, dressing, meal prep, instrumental activities of daily living, including transportation, and sometimes medical and nursing tasks. The deck here notes that Medicaid covered caregivers also provide help with 2 activities of daily living on average. And in many states, 2 or more ADLs is really the threshold used to indicate nursing facility level of care for the care recipients. And so these are really high need situations where stability and matters for both the care recipients and the caregiver. And then you overlay all of that with the research that our friends at NAC have shared around caregiving intensity on the rise and the widespread nature of emotional stress among this group. You can say that it's fair to say like continuous health coverage is really critical for this population. Next slide. So again, why is coverage important here? We know that Medicaid helps caregivers manage chronic conditions, access preventive care, get mental health supports. And when caregivers lose coverage or they face any gaps, it can really reduce their capacity to provide care. It also increases the risk of nursing home placement for older adults and increases the costs around Medicare, Medicaid, and state budgets. And so with all of this context in mind, I'll now shift to what OBA changes in Medicaid policy and the family caregiver exemption. And so as you see on the slide, OBA creates community engagement work requirements, also known as work requirements for certain adult Medicaid enrollees ages 19 to 64. The requirement is 80 hours per month of qualifying activity unless the person is exempt. And this is specific to adults enrolled through the Medicaid expansion pathway, and states must implement and verify both compliance and exemptions. Next slide. OBA broadly exempts family caregivers of a dependent child age 13 or under and or a disabled individual. And the term family caregiver is tied to the RAISE Act definition, which is intentionally broad, right? So the RAISE definition defines family caregivers as an adult family member or someone with significant relationship who provides a broad range of assistance to an individual with a chronic or health condition, disability, or functional limitations. So keep that in mind. So that means that the exemption is clear in statute, but really the risk lies in the implementation and whether states can identify caregivers consistently and also protect their exemption. Next slide. And so this section is where we really shift from what the law says to what can states control, right? What is in control in North Carolina and other states. And the report lays out options that states can use within OBA, so legally within that law to ensure continuity of care for family caregivers. Next slide. So as you see on the slide, we grouped the main state choices into four operational buckets. So thinking about timing and design, verification and data, reporting family caregiver status, and targeted outreach and communications. And I'll touch on outreach and timing here, and Brendan will go deeper into the other parts of and the other choices that states have. Next slide. And so states must conduct outreach, and the report explicitly talks about why, right? So there's past research talking about on Medicaid work requirements and how outreach is very necessary. Oftentimes there's a lack of awareness, and this lack of awareness can translate into confusion, mixed steps in the process, and procedural disenrollment. And so in the report, we point out the prior experience in Arkansas. Some of you may know about that, where low awareness of Medicaid work requirements then contributed to confusion and disenrollments in the process of implementation. And so really, when we think about targeted outreach, we're thinking about really clearly defining who qualifies as a family caregiver. Oftentimes, family caregivers don't even consider themselves in that role, or they don't know. And so being really clear about that, and also stating that caregivers are exempt, and explaining a simple way for them to report and verify caregiver status. The states can also and should partner with AAAs on this, health plans, providers, community-based organizations, because oftentimes that's where the family caregiver will turn to for support or when they need resources and so forth. So that's something to consider in this effort. And then also thinking about timing, next slide. OBA requires states to adopt the policy by January 1st, 2027, and though they can begin sooner than that. So the law also allows a one-time extension of up to 2 years. So as late as January 2029, if a state demonstrates a good faith effort and meets additional requirements. So our recommendation in the report is that timing should follow, readiness, the state readiness. So really being thoughtful and intentional about using that full period and seeking an extension if you need it to build, administrative capacity, to design caregiver protective processes, to conduct outreach, and to set up data sharing agreements that help really identify family caregivers and make sure that they have the exemption that they're entitled to. So now I'll turn it over to my colleague, Brendan, to pick it up.
Thanks so much, Adam. And we can, yes, right here, perfect. Thank you so much. And thank you everyone for being here and for giving us the opportunity to speak about this. So the slides that I'm going to cover talk a lot about the different choices that states have to make. So the OBA community engagement requirement is a federal policy that all states are required to implement and carry out. But within that, states have a lot of flexibility for exactly how they do it. And the how has really strong implications for family caregivers and other types of enrollees. One example where states have choices is with compliance verification. So the law requires that states determine both for new enrollees and for those who are currently enrolled in Medicaid to verify engagement in qualifying activity. So what's a qualifying activity? It's exactly what Adam had laid out a couple of slides ago, working 80 hours per month, being enrolled in school half-time. There's a few other of compliance activities, or demonstrating that you have an exemption, such as being a family caregiver. So for new enrollees, the law requires states to verify compliance or an exemption for between 1 and 3 months prior to the person enrolling. So if somebody's trying to enroll in January, the state can say verify for October, November, or December, or just to pick one of those 3 months. And so our recommendation is to just pick one of those 3 months to create the lowest barrier consistent with the law for family caregivers and other Medicaid enrollees, but also to, again, lower the administrative burden on states, because that's just a lot less information and data that states have to collect and keep track of. And we know that state agencies have really limited resources and are working on a really compressed timeline to implement this. And so focusing more on a single month versus several months for new enrollees and existing enrollees, I should say, will also help make this much easier for states to manage. For existing enrollees, states can, again, they can choose a single month of verification, or they can choose to require verification on an almost continuous or real-time basis. And so, again, consistent with what I had just mentioned, our recommendation is for states to require verification for a single month. For the next slide, please. Another area is with frequency of redeterminations and rechecks of eligibility. So compliance checks have to take place both at application and renewal, like I had just said. The law has changed the redetermination period for the Medicaid expansion population, which is the same one that's subject to these community engagement requirements. All redeterminations of eligibility will take place at least every 6 months. States can choose, both for the purposes of the community engagement requirement and for just general eligibility redeterminations, to check more frequently than every 6 months. So states can say, June and December, and we'll check at that point. Or they can say, we're going to check a verification for eligibility in January, in February, in March, in April, and May, and so on for every single enrollee. Our recommendation, consistent with kind of what was on the previous slide, is that states should adopt the 6-month basis, the less frequent recheck that is consistent with the law, reduces churn, which is something that we noticed, or something that does happen frequently with the Medicaid expansion population. And so anything we can do to kind of maintain stability of care is really important. And it also, again, reduces both the administrative burden for the family caregivers so that they're not constantly having to report, and then if they forget to report, they might lose their coverage. And then also, again, for the states, so that they don't have to take on the administrative burden of those continuous eligibility checks. And these are options, again, that states have within the law. On the next slide, please. Reporting the caregiver status. So under the law, states can deem certain groups as meeting the requirement, including being exempt, and not elect or not require them to provide, all sorts of detailed extra verification information. And so our recommendation in terms of operationalizing this is to make it really easy for people to report their caregiver status. Simple checkbox on forms, like being able for somebody to self-identify and say, I am a family caregiver, and make it easy for them to tell the state that information, and giving people a lot of different ways to do that. So, making it easy for people to do it online, including on their phones and smartphones. The mail, obviously, is also important. So having, a paper copy is a way for people to do this over the phone, like speaking over the phone, in person, to the extent to which that's an option, letting people verify or report their status in person, and keeping it really simple, if states elect to do this, for people to report information about the person that they're supporting, their age, their disability status. There's no requirement in the federal law that that people have to reach a certain threshold of disability. It's the definition that Adam had provided in an earlier slide, but there's no the person must have XYZ ADLs that they need help with, or they need a certain number of hours of care per week. Those are not things that exist in the federal statute. So the extent to which states can carry the implementation out consistent with the law will make it really much simpler for family caregivers to retain this coverage. Next slide, please. Notices of noncompliance. So if a state is unable to verify that somebody is either meeting the requirements or are exempt, including by being a family caregiver, there is a process that has to take place before the state can formally disenroll someone, in addition to the general enrollee rights that people have in terms of appeals and things like that. But under the law, before a state disenrolls someone because of perceived noncompliance with the work requirement, they have to send people a notice. And it has to say, we have been unable to verify your compliance with the work requirement, and give people a chance to come back and say, I'm working. My child is under the age of 13. I'm a family caregiver. I have another exemption. And so these are things that states need to do. And so our recommendation is for states to be really proactive in emphasizing the family caregiver exemption and making it clear to people that they can come back to the state and say, hey, I'm a family caregiver. I'm actually exempt from this work requirement under the law. And including, I think, a really robust definition of what caregiving is, because we know that not every family caregiver necessarily will say, I am a family caregiver or self-identifies in that role. So providing a really good definition that's accessible and something that people can actually adopt and use is very important. And then the last thing I'll say here before we move to the next slide is to check for family caregiver status in data systems. And this is something that I'll dive into a little bit later on. But making sure that there's, if before we disenroll somebody, let's look at all of our data and make sure that this person isn't either in compliance with the statute or they have an exemption, including by being a family caregiver. Next slide, please. Implementation grants. So states, the federal government through OBA is providing states with about $200 million in grant funds specifically to help states implement the work requirements. We're still waiting to hear exactly how the federal government is divvying up these funds, so I don't know exactly how much North Carolina is set to receive. But we do know that states are likely going to use these funds to hire third-party contractors, consultants, to support implementation, both probably on like the technical IT side, but perhaps also on the non-IT side and more of like the policy and operations focus. And so our recommendation for states in this context is to, when looking at vendors, to prioritize those that have some sort of experience working with or dealing with family caregivers. That includes building data systems that can identify a family caregiver that then could be used to exempt them, as well as also those that have experience delivering targeted, effective outreach to family caregivers, consistent to what I had mentioned about the non-compliance notices, and then what Adam had mentioned earlier about some of the outreach functions. Next slide, please. So ex parte verification. So this is a really important part of the legislation, and it's really important for states to use this in order to help ensure that as many people who are complying or exempt from the work requirements keep their coverage. So ex parte verification basically means using data to verify somebody's compliance or exemption. So what data sources exist that states have access to? This has typically been discussed in the context of looking at tax records to find working people and find that they are in compliance because they are working X hours per week and are show up in the tax records. Also looking at school records for the purposes of exempting parents of children under the age of 13. But it's also really important to think about ex parte verification as a tool to exempt family caregivers. There are a lot of different data sources that capture a person's family caregiving status that states might be able to use in order to say, this person's a family caregiver. We can see that they're enrolled in Medicaid through the exemption or through the expansion. Let's make sure that they're exempt from the community engagement requirements and that they don't lose their coverage. And then they don't have to talk to that person at all or make the person report their status or verify their status or anything because they have the evidence, the state has the evidence that they need in the data. This is really important to prevent inappropriate and procedural disenrollments and also to reduce burden both on caregivers, but also again on states to make sure that they're not, looking for information from people that they have in the data set already. So on the next slide, I'll talk about some examples of these. So there's two buckets that I want to talk about. There's data sets or potential data sets that exist within state and local government, but then also data sources that may exist from other entities. Each state does this a little bit differently. So North Carolina may or may not, this may or may not be as relevant, but states have Medicaid HCBS applications and person-centered care plans that often include identifying a person who's a informal or family caregiver. The extent to which states can match the information, the caregiver information from those applications and care plans to their Medicaid enrollment, that's a great way to say, these are family caregivers, they're enrolled in Medicaid, they're exempt. Similarly, a lot of states have Medicaid HCBS programs that allows family caregivers to be paid to provide care. Again, looking at that list of people, comparing it to the Medicaid enrollment and exempting anyone who's a family caregiver who's also enrolled in Medicaid. Outside of specifically just Medicaid, there's, through the Older Americans Act and the different programs that are available through that, most importantly here, the NFCSP, the National Family Caregiver Support Program, state units on aging, as well as potentially area agencies on aging and other local agencies may have records of who's a family caregiver, what family caregivers that they are supporting. And so again, the extent to which states are able to look at those records, the Medicaid enrollment, and then processing through exemptions. Similarly, SNAP, food benefits or food support includes there is a work requirement that's been around for a while. There's a more narrow exemption that exists for caregivers, but it's very likely that anyone who has an exemption from the SNAP work requirements due to being a caregiver is also eligible for an exemption under the Medicaid work requirements. And so the extent to which we can use those. And then similarly, guardianship records. And so this is going to look differently probably by state and even within states. But the extent to which guardianship records can help substantiate someone's status as a family caregiver could also be helpful as well. Looking outside of the state, there's a number of different places that states might be able to find data sets that identify family caregivers that can be used for this purpose. Managed Medicaid LTSS plans may have this information in their records, as well as Medicare Advantage plans. Hospitals and health systems may have these data through their electronic health records or other records. In many states, they're required to keep this information on file for inpatient visits under state legislation. I don't believe that's the case in North Carolina, but there may still be records within the hospital and health system. I will say I also see there's a lot of providers of other types in attendance, which is great. And so there may be other provider communities that have this type of information on file that there may be able to be arrangements made. And then finally, there's a few data sources that come from the federal side that the state really doesn't have much control over that could have information about family caregivers, including from the VA, from Social Security, and then from certain Medicare claims data. So then on the next slide, it's not necessarily going to be like a super easy process for states to get their hands on these data, particularly from those that come outside of the state agencies. There's likely going to need to be data use agreements or perhaps memorandums of understanding and other contracting vehicles. And along the way, it's really important that states ensure both enrollee privacy and data sharing integrity across systems, and particularly in the context of dealing with any sort of like health system or like healthcare related data in accordance with HIPAA. What we say often is that these data processes are really important and a great reason for states not to implement the work requirement early, and to use the full implementation period throughout 2026 to make sure that these are fully executed and done in compliance with the statute. And then the second part of this, which is also think is really important, that no Medicaid enrollee, including those who are family caregivers, should be disenrolled solely based on an AI determination. There should always be a person involved to make sure that there's no sort of like reliability or bias issue that's preventing that. Next slide, please. I'll skip this for time. That's basically a quick summary. Next slide, please. So what comes next? States will continue to plan for the work requirements throughout this year. Many are likely making implementation decisions in real time ahead of the initial implementation date in 2027. The federal government is, by statute, have to issue regulation on the requirement by June 2026. They have not done so yet, and it could happen anytime between now and June. AARP has already sent them a letter including a lot of what we had discussed here in the context of family caregiving. The link is on the slide. I also put a bunch of links into the chat just before our segment. So folks can definitely look at those for more information, including this letter. And then states may receive an extension, as Adam mentioned, on implementation through 2028. This is done really on a case-by-case basis, and it's not something that's guaranteed. There is some criteria that states have to meet that's specified under the statute, but ultimately it's up to the HHS secretary and the CMS administrator, and really at their discretion whether to approve these extension requests and for how long. That's all we have. So you can definitely go to the last slide. We have our contact information here and also in the chat. We have about 2 minutes left. So I will turn it back over for the moderators to close it out. Thank you.
You're on mute, Mary.
Yes, not like me to be silent. So thank you so much. I mean, that's great information and gives us lots of ideas of things that we as advocates need to do to be vigilant in this process. That's for sure. But thank you so much, both of you. Elaine, anything you want to add from the standpoint of National Caregiver Alliance? Alliance for Caregivers, I'm sorry.
Hang on, it took me a minute to come off mute. No, thank you. That was a fantastic presentation, and we are going to be working. We have a Caregiver Nation coalition that NAC runs, and we're going to be working on a letter to Dr. Oz, also reemphasizing the need to, accept the RAISE Act definition of family caregivers, and also reminding them of all these data sources that do exist, because we don't want them to say, oh, we just couldn't find those family caregivers. So in collaboration with ARP, the good materials they're putting out, the work that we're doing with other colleagues, we're trying to make sure that family caregivers stay visible. And we'll also be working on a webinar for February. So stay tuned, and we'll have that date and information about that for advocates to learn more about work requirements.
Great. Thank you so much, Elaine. And I'd like to recognize Karen Apert. Karen, raise your hand there. Karen leads up our Caregiver Collaborative in North Carolina, and I'm sure is going to be spearheading some efforts with the collaborative to make sure that a lot of information we've heard here today is relayed to our state officials as we move forward on this. And Karen was very helpful in getting folks from the National Alliance for Caregiving here today. So thank you, Karen. And Heather Altman, where the Caregiver Collaborative falls under North Carolina Serious Illness Coalition. Thank you both so much for that. So we've got a few minutes. We got a lot. We're out of time, but we started. We spent a lot of time on the first part of the meeting. I know a couple of you had questions. If you want to ask them, I see Gina Upchurch. I see your hand raised.
Yeah. First of all, thank you for wonderful presentations and helping us prepare. Quick question. So really all the comments about using data sources that already exist, don't reinvent the wheel, excellent. And letting us know how there can be exemptions. So I'm with an agency, and we screen people all the time for Medicare Part D, low income subsidy, Medicare savings plans, Medicaid. But we struggle, particularly we're putting people in Medicare DSNPs, and we can't figure out what level of MQB do they have. So then we call our friends over at DSS and try to get some information. Have other states done a good job of allowing other social service supporting agencies to tap into the electronic Medicaid system so that we can see things and help be a little bit more efficient? Because there is churn, there is overburden at DSS offices. So are there states that have supporting agencies helping with some of these applications and that kind of thing for the traditional Medicaid as well as the extension, the expansion group? Thanks so much.
Yeah, of course. I mean, I think it's always kind of difficult getting good data from the states in general, just because there's a lot of different privacy considerations, et cetera. So I can't say immediately oh, this state does a really good job at it. But I think what this work requirement policy does really underscore is the importance of having open lines of communication between state agencies and different and the supporting agent and supporting organizations and providers for exactly this type of purpose, to help kind of reduce churn, really reduce administrative burden, both for the organizations as well as for the state agencies. And hopefully as these relationships take place in the context of the work requirement, there could be lessons learned that then could also inform other efforts, such as what you had mentioned. But I think it's definitely going to require a lot of data use agreements, MOUs, et cetera, just to make sure that everything is done above board. But hopefully that's something that we'll see happen soon.
Great question. Thank you, Brendan. Another question? Sandra, you see any hands raised from anybody? I would just say, I think this information is, we've had kind of two separate presentations here. I think the caregiving data, as I said before, is just going to be critical to us in helping tell our story about why we need to do efforts to support caregivers, but also how this fits into the whole long-term care services and supports discussion. While we had the meeting going on, I did print out the North Carolina fact sheet for on the caregiver data. It is really good information. So I think it's something all of us can use. So I expect everybody's newsletter next month is going to have some information in there about that with this good North Carolina data. Thank you all for being here. I mean, I think the information you shared with us today is just hot. It's hot off the press, but it's also information that's going to help us all do our jobs better. We hope that we can continue to have lines of communication open with all of you. And, you know, our work has just begun on this whole process of telling our story better, but also particularly with the community engagement or work requirement provisions, making sure that we are at the table with discussions that are going on and how we move forward on this. And I think, as Brendan, I think as you said, you know, communications is critical to this whole process. All right. Does anybody else have anything for the good of the cause? I don't see any hands.
I did want to just let everybody know that the PowerPoint slides will be on the coalition's website this afternoon. Just look under the members tab and you'll find them there. Okay.
Are you going to send them out also, Sandra, separately, or just direct people to the website?
It's probably easier to direct them to the website for that, but we'll put it in the newsletter next week. We can put it in the newsletter with a link to them as well.
Yeah, very good. All righty. Well, y'all stay safe and warm and off the ice. It sounds like, and let's all keep our fingers and toes crossed that, you know, we don't get all this ice. It's going to be that could have potential to be so destructive. But thank heavens for Zoom meetings, and let's hope that we all have internet next week. Correct. All right, guys. Thank you so much. Good to see everybody. Bye bye. Thank you, our speakers.
Yes, thank you to the speakers.